Welcome back to Transcriber from Reddit. Today's topic actually comes from a website called the Liz Library. This article from the Liz Library website is titled The Effects of Pregnancy. What women are, quote, at risk, quote, for complications? All of them. Every minute of every day, somewhere in the world, most often in a developing nation, a woman dies from complications related to pregnancy or childbirth. And that's just talking about the immediate physical, that word is in italics, repercussions. Side note, I wanted to do a read of this primarily because I found it interesting, brought up in a discussion I had with a friend of mine, that many do not know, including myself, the effects of pregnancy. So then I did a little bit of digging and I came across this site. Before I continue reading, I will deviate from the printed text here and scroll down to cover immediately the side effects of pregnancy, starting with normal, frequent, or expectable temporary side effects of pregnancy. First point, exhaustion, in parentheses, weariness common from first weeks, end parentheses. Second point, altered appetite and senses of taste and smell. Third point, nausea and vomiting, parentheses, 50% of women first trimester, end parentheses. Fourth point, heartburn and indigestion. Fifth point, constipation. Sixth point, weight gain. Seventh point, dizziness and lightheadedness. Eighth point, bloating, swelling, fluid retention. Ninth point, hemorrhoids. 10th point, abdominal cramps. 11th point, yeast infections. 12th point, congested bloody nose. 13th point, acne and mild skin disorders. 14th point, skin discoloration, parentheses, chloasma, face and abdomen, end parentheses. Point 15, mild to severe backache and strain. Point 16, increased headaches. Point 17, difficulty sleeping and discomfort while sleeping. Point 18, increased urination and incontinence. Point 19, bleeding gums. Point 20, pica. Point 21, breast pain and discharge. Point 22, swelling of joints, leg cramps, joint pain. Point 23, difficulty sitting, standing in later pregnancy. Point 24, inability to take regular medications. Point 25, shortness of breath. Point 26, higher blood pressure. Point 27, hair loss or increased facial/body hair. Point 28, tendency to anemia. Point 29, curtailment of ability to participate in some sports and activities. Point 30, infection including from serious and potentially fatal disease. Parentheses, pregnant women are immune suppressed compared with non-pregnant women and are more susceptible to fungal and certain other diseases, end parentheses. Point 31, extreme pain on delivery. Point 32, hormonal mood changes, including normal postpartum depression. Point 33, continued postpartum exhaustion and recovery period, parentheses, exacerbated if a C-section - major surgery end - is required, sometimes taking up to a full year to fully recover, end parentheses. All right, now we move on to normal, expectable, or frequent, permanent, permanent is in all caps, side effects of pregnancy. Point number 1, stretch marks, parentheses, worse in younger women, end parentheses. Point 2, loose skin. Point 3, permanent weight gain or redistribution. Point 4, abdominal and vaginal muscle weakness. Point 5, pelvic floor disorder, parentheses, occurring in as many as 35% of middle-aged former childbearers and 50% of elderly former childbearers, associated with urinary and rectal incontinence, discomfort, and reduced quality of life, aka prolapsed uterus, the malady sometimes badly fixed by the transvaginal mesh. Point number 6, changes to breasts. Point number 7, increased foot size. Point number 8, varicose veins. Point number 9, scarring from episiotomy or C-section. Point number 10, other permanent aesthetic changes to the body. Parentheses, all of these are downplayed by women because the culture values youth and beauty, end parentheses. Point number 11, increased proclivity for hemorrhoids. Point number 12, loss of dental and bone calcium, parentheses, cavities, and osteoporosis, end parentheses. Point 13, higher lifetime risk of developing Alzheimer's. Point 14, newer research indicates microchimeric cells, other bidirectional exchanges of DNA, chromosomes, and other bodily material between fetus and mother, parentheses, including with, quote, unrelated, end quote, gestational surrogates, end parentheses. Next, we move on to occasional complications and side effects. Point number 1, complications of episiotomy. Point number 2, spousal/partner abuse. Point number 3, hyperemesis gravidarum. Point number 4, temporary and permanent injury to back. Point number 5, severe scarring requiring later surgery. Point number 6, forgot the parentheses for point number 5, parentheses, especially after additional pregnancies, end parentheses. Point number 6, dropped, parentheses, prolapsed, end parentheses, uterus, parentheses, especially after additional pregnancies, and other pelvic floor weaknesses, 11% of women, including cystocele, rectocele, and enterocele, end parentheses. Point number 7, preeclampsia, parentheses, edema and hypertension, the most common complication of pregnancy, associated with eclampsia, and affecting 7 to 10% of pregnancies, end parentheses. Point number 8, eclampsia, parentheses, convulsions, coma during pregnancy or labor, high risk of death, end parentheses. Point number 9, gestational diabetes. Point number 10, placenta previa. Point number 11, anemia, parentheses, which can be life-threatening, end parentheses. Point number 12, thrombocytopenic purpura. Point number 13, severe cramping. Point number 14, embolism, parentheses, blood clots, end parentheses. Point number 15, medical disability requiring full bed rest, parentheses, frequently ordered during part of many pregnancies varying from days to months for health of either mother or baby, end parentheses. Point number 15, diastasis recti, also torn abdominal muscles. Point number 16, mitral valve stenosis, parentheses, most common cardiac complication, end parentheses. Point number 17, serious infection and disease, parentheses, e.g., increased risk of tuberculosis, end parentheses. Point number 18, hormonal imbalance. Point number 19, ectopic pregnancy, in parentheses, risk of death, end parentheses. Point number 20, broken bones, parentheses, rib cage, in quotes, tailbone, end parentheses. Point 21, hemorrhage and, leading into point number 22, numerous other complications of delivery. Point number 23, refractory gastroesophageal reflux disease. Point number 24, aggravation of pre-pregnancy diseases and conditions, parentheses, e.g., epilepsy is present in 0.5% of pregnant women, and the pregnancy alters drug metabolism and treatment prospects, all the while it increases the number and frequency of seizures, end parentheses. Point number 26, severe postpartum depression and psychosis. Point number 27, research now indicates a possible link between ovarian cancer and female fertility treatments, including, quote, egg harvesting, end quote, from infertile women and donors. Point number 28, research also now indicates correlations between lower breast cancer survival rates and proximity in time to onset of cancer of last pregnancy. Point number 29, research also indicates a correlation between having 6 or more pregnancies and a risk of coronary and cardiovascular disease. Next, we move on to the section of less common, in parentheses, but serious, end parentheses, complications. Point number 1, peripartum cardiomyopathy. Point number 2, cardiopulmonary arrest. Point number 3, magnesium toxicity. Point number 4, severe hypoxemia/acidosis. Point number 5, massive embolism. Point number 6, increased intracranial pressure, brainstem infarction. Point number 7, molar pregnancy, gestational trophoblastic disease, parentheses, like a pregnancy/induced cancer, end parentheses. Point number 8, malignant arrhythmia. Point number 9, circulatory collapse. Point number 10, placental abruption. Point number 11, obstetric fistula. Next and final section we move on to is more permanent side effects. Future infertility, point number 1. Again, that's point number 1, future infertility. Point number 2, permanent disability. Point number 3, death. Alright, now that I have paused for silence for those women who have undergone those permanent side effects, my heart goes out to them, their lives that were cut short, and the families that were deprived of their mothers, as well as the babies that were lost during those times. Now, I will go back up and continue reading the article. Below is a partial list of the physical effects and risks of pregnancy. This list does not include the many non-physical effects and risks a woman faces in reproducing, such as the economic investment of work interruptions from pregnancy and breastfeeding, or time lost from career and other opportunity costs involved in pregnancy and later child-rearing, parentheses, mothers comprise 90+% of primary parents, end parentheses, or the emotional trauma of problem pregnancies, or the numerous economic and lifestyle repercussions that pregnancy and motherhood will is in italics, have on the remainder of a mother's life. This page was written in response to the popular but mother-denigrating and nonsensical notion that, absent a substantial investment of some other sort, i.e., absent committed is in italics, emotional and financial support of the mother of his child through pregnancy and beyond, and a familial relationship with both of them, in fact is in italics, a father is in quotation marks here, or quotation father, end quotations, is without anything more a father, let alone an quotation marks equal parent, end quotations. We have been culturally conditioned to accept some incredible and false ideas. But, and this part is in bold, it is offensive to assert that pregnancy impacts men in any way equivalent to its impact on women. End bold. That fathers and mothers have comparable experiences or feelings in connection with pregnancy or their babies. That non-resident unwed fathers, based on DNA, ipso facto, quote, should, end quote, have, quote, rights, end quote. That, from the standpoint of family laws or women's choices regarding abortion, pregnancy should be viewed as nothing more than an, quote, inconvenience, end quote, or that the riskiest, quote, jobs, end quote, in this world all are performed by men. Parentheses. Compare the percentages of women carrying the scars of pregnancy with the percentages of men who carry the scars of battle. End parentheses. Side note, I hope that this transcription brought some clarity, and I hope it brought every single person listening to this a moment of introspection, whether you're male or female. And this is just basic biological male and female. If you're male or female, think about hypothetically what your role in pregnancy and having a child would look like. And I want you to compare the risks that the pregnant person in your relationship would face versus the non-pregnant person in the relationship. Men can go back and get more money. Women can't go back and get their previous body. Also, it is very important to me to point out that if it wasn't for this site, I wouldn't have known about all of these possible side effects from pregnancy. This is as much to inform the ladies in the audience, and I hope that they will inform other ladies elsewhere of all of the potential side effects of pregnancies. Knowledge is power, and with that power comes responsibility. Not just for you, but also in knowing whether or not it is safe for you to go ahead and have children. Maybe it makes more sense to just be child-free. Maybe it makes more sense to adopt if you really want a child. But understand your body, understand the risks that you are facing, not just this list right here, but also your medical history. Know all of that and make the best possible informed decision. All the future children's lives and quality of lives are hanging on that. That concludes today's video. Please consider liking, subscribing, sharing, leave a comment down below, and I will see you in the next one. If there is something that I missed, please let me know and I will do my best to make a follow-up video to it. Thank you.